So the question is, how do we regulate this? And I've had three options presented to me. And I'd like your kind of take on it, or maybe four. One, have AI validate AI. And someone says, you got to be kidding me. AI cannot validate AI because it depends upon making sure that they have the same data sets upon which they are trained and are equally robust. Secondly, let's do what we did with the Sherman Antitrust Act. Just give the courts some sort of kind of barriers, guidelines. Okay, courts, you got to stay within this. We can't imagine what's going to happen in 100 years. Courts figure it out. But then someone said, you got to be kidding me. You got to understand something before you can have a court ruling. And you think some judge is going to understand this? No, it was a lawyer who told me that. So I'm a gastroenterologist, so I'm just going to, take it his kind of minimization of the judge's ability to comprehend. The third is to say, if we're talking about healthcare, to go, for example, to the American College of Cardiology, and they say, we want you to be the third party that will validate that everything out here is going to be okay for a cardiology patient. Now, since a cardiology patient with congestive heart failure can have kidney disease and can have diabetes and can have hypertension and be at risk of stroke, I think you almost end up treating, by the way, be HIV positive. It almost seems like you end up the whole shebang, even though you think you're going to limit it. But actually, that's the one that seems most valid to me because you actually have subject matter expertise kind of penetrating there. Now, I've given you that context. Clearly, I'm meditating on this before I go to bed. Let's start with you, Dr. Baker, and then just work down. And please be tight with your answers.
Thank you. I think it is crucially important that humans be involved in validating the outcomes, but I hope that there's an opportunity for public-private partnership and also for consortia of private entities to have multiple views on the same data set in different contexts and have consensus across them in which algorithms are actually achieving the goals that they say
Practically, that seems like that's going to be incredibly cumbersome. And this seems like a really agile field that's going to race ahead.
But that's why I think having a fixed structure is less likely to be agile than having multiple parties able to weigh in on whether the algorithms.
Now, some of this is proprietary, so would that kind of defeat it if it's proprietary?
I think there needs to be regulation that ensures access to the outcomes and to the crucial inputs of the data so that third parties can see what's happening.
Okay, Dr. Obermeyer.
I think there's a nice analogy to how the FDA regulates drugs. When we regulate drugs, the FDA requires that the manufacturer specify the primary outcome. What is the health thing that this drug is affecting? And it requires them to show that the drug affects that outcome in a rigorous way, usually via a randomized trial. With algorithms, I think we should know what the algorithm is predicting, and then I think we should rigorously evaluate how that algorithm is doing its job in a new data set that it's never seen before, which is a key part of how machine learning gets evaluated everywhere. And I think that
Now, that would presuppose, though, that every time you update it, you got to do retesting.
So I think that there's ways to put in structures for continuous monitoring. So it only requires the algorithm to produce.
I'm running out of time. Dr. Mello.
I think we've learned that there are models that can usefully evaluate some aspects of other models. For example, the developers at Stanford released a model called A+ that evaluates algorithmic bias as an open source tool. That's great. But there are so many other aspects of safe and responsible use of AI that do require human review. I think physicians can be very helpful in spotting issues that will happen when physicians interact with those tools. But generally, I don't think medical professional societies are fully up to the task of vetting some of the issues.
Then
that
who
will
would
arise. I think you're talking about creating what we might call assurance labs that bring together data scientists with
Dr. Sindak.
Sorry. In silico testing in a third-party validation environment is necessary but not sufficient. And as a practicing physician, different environments are different. Every healthcare organization needs to be able to locally govern AI, and that means
that seems impossible.
They locally govern quality of care, and healthcare services will
I can tell you, the
become,
small little rural hospital ain't going to do it. But Dr. Shin, Mr. Shin, I'm sorry.
Yeah, I think, Senator, it's very important here to really distinguish between FDA-regulated AI and other types of AI, like generative AI. I think FDA-regulated AI, again, goes through a regulatory approval process with the FDA where we have to declare the intent of these AI algorithms and what is the clinical use associated
But clinical
with it.
support, for example, how do you deal with a heart failure patient?
Exactly. So that framework actually is sufficient to support AI innovation. And we can support kind of this continued flexibility in that approval process to look at how clinical AI can be adopted going forward.
Thank you. I
I
yield.
thank my